Oral presentation number 1. My name is Glenn Rowe, and I work in the Wound and Hyperbaric Healing Center at Ridgeview Medical Center in Waconia, Minnesota. Our clinic works primarily with chronic, non-healing wounds. Our staff of nurses and doctors also see people who are inpatients at the hospital as well. The Ridgeview Wound Healing Center began 8 years ago with one nurse who convinced the hospital administration team that a wound center would provide a vital role in patient care. The administration team agreed, and our clinical manager began seeing patients 2 days a week in a vacant room in the emergency department. The patient load quickly began to expand, and she moved wound healing into a room in one of the family practice suites in a neighboring building. After 7.5 years of seeing patients in a borrowed room, the hospital began construction on our new Wound and Hyperbaric Healing Center. Our staff now includes a medical director, one podiatrist, one nurse practitioner, 3 nurses, 2 front desk staff, and myself. My role in the wound clinic is hyperbaric technician and safety director. The patients that we see have a range of issues anywhere from diabetic foot ulcers to chronic refractory osteomyelitis. In the wound clinic, we have the expertise to heal chronic wounds that patients have been dealing with for not only months, but in some cases several years. In our clinic, patients come to us sometimes as a last resort. Many of the patients we see have never even heard of a clinic that deals specifically with wounds. Oftentimes, these patients have been going to their primary physicians to get their wounds to heal. In our center, we believe that a patient with a wound that has not seen any improvement within a 2-week period should be immediately referred to a wound center before their condition gets out of control and can often lead to an amputation. Approximately 6 months ago, our wound center teamed up with an organization called Healogics out of Jacksonville, Florida, and we installed 2 monoplace hyperbaric chambers. There have been times where our team of highly trained physicians and nurses cannot heal a wound, so the hyperbaric oxygen therapy becomes the next level of care in the healing process. Hyperbaric therapy has been around since the 1800s, but has recently become the new miracle drug, and centers are popping up all over the country. I currently have patients that I'm dealing with and being treated for diabetic foot ulcers, refractory osteomyelitis, skin graft preparation, and soft tissue radionecrosis. There are some non-hospital-based hyperbaric centers that claim to have seen improvement with conditions such as autism and traumatic brain injuries, but until these conditions are approved by the FDA and Medicare comes on board, we will not be seeing these types of patients. Our patients are treated for a total of 20 to 40 times based on their condition. The commitment for a patient to come to our clinic every single day for sometimes 8 weeks is enormous, but it certainly beats the alternative, which could possibly be an amputation of a limb. Our patients commit to arriving 1/2 hour prior to treatment so I can take vital signs, do a blood sugar check, and they can change into our 100% cotton hyperbaric approved gowns. All patients are seen by the provider on duty and have their heart and lungs listened to and their ears checked for any barotrauma. Immediately following treatment, patients once again have their vital signs as well as blood sugars checked and have a short visit with our provider. I also have a checklist of approved and prohibited items that a patient can or cannot take into the chamber with them due to safety reasons. I stress to all of my patients that if you weren't born with it and I don't physically hand it to you, it does not enter the chamber. Even such things like deodorant, perfumes are not allowed in the chamber due to the off gas that they produce, which could ultimately lead to a fire or an explosion in the pressurized chamber. At the Ridgeview Medical Center, our wound clinic provides an opportunity for patients to return to normal with the absence of their chronic wound. Everyone deserves to lead a healthy life, and with our help, it's possible. Thank you.